It's a beautiful sunny day here in Rochester, Minnesota. Great day to discuss healthcare. I find the healthcare industry extremely fascinating, and I'm so excited to finally get to focus on the healthcare space. The healthcare industry is one industry where if you get a null pointer exception, you could drastically alter someone's life. And I'm not saying that in jest. That is the truth. And you will see that in this presentation that getting the data to the right person at the right time, at the right place, can drastically affect the outcome for a patient. So before we begin, let's take a look at the complexities of receiving health care, okay? We all need medical help at some point in our lives. If not you right now, think of your grandparents, your parents, your spouse, your children. And when there's multiple players involved in providing health care to you, just several different players that need to come together. But you as a patient, when you go to receive care, you expect, especially today, everything should be connected and it should be streamlined. Because most of the time when you're receiving health care, you're not feeling well, right? You're not up to snuff to organize and coordinate and double check everything yourself. So you expect this to happen for you. When all of these providers being able to work together in a streamlined fashion really determine your well-being and your outcome. A mistake or misinformation in any one of these areas could provide a not so good outcome. And while you expect a good outcome and you expect a streamline because you're paying for it, we as patients are flipping more and more of the bill, and so we expect a higher level of service. And if you're one of the lucky ones to live in a location where you have a choice of who your providers are, who the people are that are going to be providing the services to you are going to choose the provider that provides the most streamlined, the most, what do I want to say, great experience of a healthcare that you can imagine. So to you, you're getting healthcare in a single one solution. So let's now look at the complexities of providing healthcare. Okay, like I said before, patients as expect an extremely integrated, streamlined experience. They don't care that the ambulatory service is different from the hospital services or that the transcripts are in a different system than the laboratory systems and so forth. They want everything together. We are in the digital age. As I said before, consumers expect our services just to work. They expect more. So the truth is, though, providers have a very, very difficult task. They must distribute and receive information from all the players in the space, and they receive it in many different forms. So let's take a little step back here and take a look at how it began. Well, first, there were paper files. I remember just 12 years ago when my kids were born, my first child was born, I had a very thin file because I hadn't had much medical history, and it literally was a file with pieces of paper. By the time my second child was born a couple of years later, my file grew to 2 inches, and it literally was passed between department and department. That was my file passed around. Now, turn just about 4 or 5 years ago, I noticed when I was taking one of my children into the emergency room, the files did not exist anymore, and it happened to be that night that they were transitioning to an electronic health system. But the times are changing. However, a lot of the data is still transferred between entities by scanning files into PDFs and either emailing them or sometimes scanning the files, printing them out, and FedExing them to the other players within the healthcare ecosystem that needs that information. And then when the player receives that information, they either print it out and stick it in your file in their system, or they attach it if they have medical, an EMR, they attach it to the EMR. Still, a lot of errors can go through. So as you can imagine, this way of sharing files took a long time, lots of resources, and costing both the patient and the provider lots of resources, time and money. And then with this way of transferring your medical files and information, mistakes happen, which cost patients not only in terms of monetary costs, but also in quality of life, in life or death situations, but also it provides cost providers an extreme amount of money, and you can imagine in all the different ways that this would be inefficient to move data to and from different players in the ecosystem. Well, around 2009, 2010 came the meaningful use regulation. Now, the meaningful use regulation was, like I said, introduced in 2010, which really corresponds about the time that my provider switched over to an electronic system. This regulation was designed to digitize healthcare records in order to really improve the quality, safety, and efficiency that we receive healthcare and record our healthcare. It was put in place to allow patients and families to engage more with their healthcare providers, improve the coordination between all of the different players, and really help maintain the privacy and security of patients' health information. In a utopian situation, when the meaningful use is fully engaged and active across the whole healthcare ecosystem, we should be able to get better clinical outcomes. We should improve the population health outcomes. We should increase transparency. We empower the patients. We empower ourselves to have control of our own health, and therefore it should reduce the cost on the providers and the ecosystem as a whole. And we should, through the meaningful use, be able to build more robust research data with our health systems. Now, back in 2010, there was 3 stages of adoption of the meaningful use, according to years. And if you were a provider and you participated in the incentives and got certified in each one of these stages, you got an incentive. Now so the first stage was, just as I said, just start capturing your medical information in an electronic healthcare record with a certified EMR system. So that stage 1 started between 2011 and 2012. Right now, most people are within stage 2, where they're doing some advanced clinical processing. 2016, that is when stage 3 is supposed to start. That's when we can start leveraging this information to really improve healthcare outcomes. Now, then we'll also flip at 2016, start flipping, instead of having incentives where you will have penalties you'll have to pay for not being able to prove that you are adhering to the meaningful use regulations. So with meaningful use regulations, then entered electronic medical record software. This, I remember when I introduced when I went into that ER, that was probably the first week that my provider was using the electronic medical records, and it was a huge learning curve back then. And I remember everybody involved in trying to get the system up and running and using the system, they weren't happy. But let me tell you, now when I go in, it's so seamless now. So it's easy to enter the data, and the data is there across all across the whole provider, each of the different departments, the emergency room for my primary care, and so forth. The thing that's one of the caveats about that we've been finding about the electronic medical record software is that, well, it's easy now to enter the data in. It's not so easy to get the data out or to share. So let's talk about that. So when you have a provider that needs to, for example, communicate with community care or home care or any one of a specialist or something that's outside of the provider, what is happening today is the EMR you can zip up the electronic medical record into a PDF file, and that PDF file is emailed to the particular player that's involved. Okay, maybe that player will print it out and file that record in a file the old way. Maybe the next player will attach it to another EMR. The problem with this is that while it is easier to send the information from email in a consolidated form like a PDF, it's still not easy to get at the data and get that data out of the PDF in a timely manner, or to do any sort of decision processing on the bits of information inside that medical record, that PDF file. So how do we get to stages 2 and 3 of the meaningful use, right? How do we get to that higher value service? You know, how do we move beyond the basic integration woes between the providers and the payers and the providers and the lab services and the ambulatory services? How do we unleash the data in those EMR systems and other data sources within the healthcare ecosystem? How do we provide, let that data provide insights for information? For innovation, how do you differentiate your healthcare services? And that's really what we want to get to, is not just working on the plumbing of how you connect with others in your healthcare ecosystem, but how can you differentiate your healthcare services in this very consumer eccentric world where the choice is now being placed more on the patients for them to choose what to do. APIs provide the foundation for the digital healthcare. And I'm not talking about traditional APIs for application-to-application communication of the past, right? Because that's where we are now. I'm talking about APIs in terms of the API economy, the digital world, APIs that allow easy access to data trapped within all these systems. And I'm talking really about APIs. And as I said before, when I talked a little bit about the EMRs, they're starting to provide API access to it to make it a little bit easier to pull data outside of the EMRs and share it. Okay, so why healthcare APIs? Well, it brings data into reach of everyone. RESTful APIs are developer friendly. RESTful APIs can be read by, it can be human readable in a browser. If you're trying to get some data set for a clinician that they want, you can create that data set, give them a URL and say, put it in your browser. Hey, is this what you're looking for? In a very timely manner. Or the clinician, if you have a developer portal, can easily go and look up that information and say, you know what, this is the type of information I want. It puts the data in the hands of the people that can use it. It makes it understandable and even allows for even the most, somebody that, I don't know how, I'm trying to phrase it, somebody that's just not technically inclined to be dangerous with building applications. SOAP APIs are, they're still out there, and they can be, to some extent, developer friendly, though they're not as popular in the developer community. I mean, again, they're not as easily human readable by humans, right? So somebody that's not technically inclined wouldn't be able to easily understand, that SOAP API. That's why REST is a little bit more easier. One of the key things that APIs allow us to do, especially RESTful APIs, is it allows us to break the data up into chunks, which become more easily used and being able to analyze. Instead of having that big, huge PDF of an electronic medical record that you have to sift through to find maybe the observation that you're looking for, you can, and then try to compare that with several other patients or something, you can easily get in and get that information with an API. APIs also increase interoperability. Okay, it does. It just makes it more easy. If somebody says, oh, I've got an API, here it is, you can go get it and put it into your system. It's relatively easy to do that. And it lowers the cost of integration. So APIs will solve all of our integration woes, right? This is great. We just need an API. Or will they? Well, now I can easily get at the data, but what does that data mean? How do I map that data if I don't know what it means? How do I know that patient name is really the patient name that I have, or this particular observation field is really what I mean by this particular observation value? How do I know, right? When you're dealing with several different players in the ecosystem, you all can have your own interpretation even within a particular standard. This is where the FHIR specification comes to play, and it's led by HL7. So FHIR really is the next generation of healthcare standards, and it's really based off of the best practices and lessons learned of HL7 V2, which we all know, V3, and the CDA product lines. The thing about FHIR is it leverages the latest web standards and, most importantly, focuses on implementability, okay? It's open, it's an open standard and free for all to use and contribute. And if you want to start participating, you can go to that URL that I posted up here on this webpage. And again, the slides will be available in after the presentation. All right, so let's take a little bit closer look at FHIR and what are its main principles. And I love that it has principles set out. And it's grouped into 3 different categories: scope and priorities, open development and implementation, technologies, and dependencies. I think one of the big things here, one of the major guiding principle is that FHIR prioritizes implementation, because standards that don't get implemented or implemented poorly don't benefit anyone, and they don't get adopted. And so we're all still back where everybody's producing their own APIs and nobody knows what anything means. And when I say it's one of the main reasons that everything that they do prioritizes implementation, because standards that place theoretical correctness or clinical perfection or modeling approaches or preferred architecture or any other priorities above this are unlikely to see adoption, right? Because you need to be able to implement it to get adoption and to benefit anyone. So implementation is incredibly important, right? And then there's other things like provide flexible framework for interoperability, keep complexity where it belongs. The other major principle that I think is wonderful is leveraging open source development principles, and it's free to use, right? This will really drive adoption and make healthcare a lot easier, healthcare interoperability a lot easier and more attainable for even the smallest player in the healthcare ecosystem. You don't have to be a big player in order to be interoperable. Even really small players can be interoperable. The technical and technology and dependencies, those principles are all great as well. Support multiple exchange paradigms and architectures. Leverage common web technologies. So this one is really important too, because you're leveraging common web technologies. You don't have to have a defined specialist in one particular area, right? You can have developers and architects that you have a broader source of pool where you can pull resources from to do your implementation. So there's great guiding principles, and you can find the stronger definitions of them on the website that I posted prior. So the FHIR specification itself contains 3 parts. Okay, there's the general documentation. This is basically how the resources are defined, gives background material of definitions of data types and codes and, the XML and JSON formats. It provides detailed descriptions on implementation, on how to use resources using REST, messaging, clinical documents, or even in a service-based architecture. And then it provides one of the most important things. It provides a resource list, a list of all resources defined by FHIR, right? Right now there's around about 99 resources, and some of them are approved, some of them are up from candidate, are up for votes to be included. So there's 99 defined, some of them are approved, some of them are still in the process of being worked and being approved. Here's an example of a patient resource. So I'm going to specifically look at the FHIR RESTful APIs. FHIR provides a RESTful API. It's very simple to use. That's the key thing. Extremely simple to use. If anybody's used Salesforce API, it reminds me a lot of the structure of Salesforce API, where you have a base, a type, an ID, and different types of searching that you can do. It has hypermedia tendencies. Everything is a link. The records are immutable. So for example, it's pretty easy. If I know that there's a patient object, I can, put the patient object in there. I know there's an observation, a procedure, and so forth, and I can pull information and figure out what, for a particular FHIR implementation, what they're using. So FHIR resources are very generic by design. So for example, here's an observation. Okay, there's a bunch of attributes here, name, value, and so forth. They give kind of a rough, if it's required or not, how many times it can occur, and so forth. But what really is an observation? Well, an observation for an app that monitors diabetes could be glucose measurements. It can be for an application capturing smoking status. It could be a smoking status code. It could be lab results. It could be used for genetics. So what is this particular observation? What is it? What does it mean, right? Well, in order to decide what it means, profiles are a key construct that really provide the meaning towards the resource. What you're seeing here is a DAF smoking status profile. This profile, when sent along with that FHIR resource, gives meaning to that observation. So if you've got two systems that are dealing with smoking status, if that profile is passed along, the second system will be able to know, oh, yes, I know that profile. I know what to do with that data, how to display it, what it is. It's important to note that the profile does not change the structure of the resource. It's still that FHIR resource underneath. It just tells the system that's using it or whoever's pulling the information a little bit more about what that information actually means. Okay, so the great thing about this when using the FHIR API with these profiles, systems can potentially automatically determine integration compatibility based on these profiles, right? You could really do some really interesting stuff and automate stuff and simplify your integration and increase your interoperability. And there's for resources, there's and I didn't put the link here, but you'll be able to find it off that main link. For each resource, there's profiles that have been defined that you can use. For example, this DAF profile, smoking status profile. So in order to help accelerate FHIR adoption and help accelerate the profile creation, a group got together to create what's called the Argonaut Project. It's a group that's set up to sprint on the implementation of FHIR. It's a time-limited group project. This work group provides feedback to the FHIR community for changes that need to be made to the standard, to the resources, and so forth. It provides a profile for leveraging the specification. So remember I said there's a total right now of about 99 resources up for candidacy to be included in FHIR. Some of them are accepted, some of them are still in candidacy. The Argonaut project really focused on 16 resources that implemented the most common use cases from a healthcare provider's perspective and created profiles for those. And you can see there's an overview presentation down here You can click that link. It'll take you to the Argonaut Project, and it'll explain a lot more to you. Besides creating these profiles, one of the things that the Argonaut Project was working on is providing security implementation requirements. So along with a profile, an API could have, or a resource could have security labels attached to it, which really tells you, who can see the bits, the particular bits of data and all sorts of things within that resource, within that data object. So this is great. Okay, now we are about ready to implement interoperable healthcare. Okay, so we have a FHIR specification for resource, right? For resources, we've got profiles for implementation of the common healthcare use cases, and we've got a security specification. But how do we actually implement this? How do we set this up? All right. Things you need to consider. So when you're going out about this, we're gonna build this FHIR. First thing you're going to need is you're going to need to build your own FHIR server. Okay, you need to implement a FHIR server. There are FHIR servers available out there, reference implementations, open source, you name it. And again, if you go to that website I have on a previous slide, the FHIR website, they will list the implementations out there. The next thing you need to think of, okay, well, great. How are you going to govern the creation of the FHIR services that you deploy to your FHIR server? Okay, what's the life cycle of those things going to be, right? How often can you change them, right? Are you going to version your FHIR services? Remember, one of the criteria is upward and downward compatibility. So how are you going to version and manage those? Next, now that you have the FHIR services, how are you going to expose the FHIR APIs? Is this particular API or resource going to be exposed internally only? Is it going to be exposed externally to partners? Or could you possibly have an open API, something that you would like, to let Fitbit group developer community work and integrate into something, right? What are you going to do with this API? Once you figured out what you're going to do with this API, how are you going to manage the consumption of that API? How are you going to keep track of the developers, the licenses, the terms of use, the quotas per developer? All of those different things that you're going to have to think about. Are you going to charge for usage? If so, how are you going to charge for that usage? Okay, especially from working with a medical device company that has a bunch of data around the medical device usage. That data is, incredibly important, and people would pay to actually have access to that data. Okay, healthcare is one of the industries that security is utmost important. How are you going to secure these APIs? How are you going to monitor the system? How are you going to monitor the consumption, right? Can you leverage, and then now we're going to try to go to that higher value asset. Can you leverage the analytics to provide a differentiating healthcare service? These are all the things that you need to consider in your next generation healthcare platform. So as I was talking about, let's cover this. One of the things I said, you're going to need a FHIR implementation. One of the implementations that is out there is called Happy. It is an open source FHIR library. It not only provides a FHIR server with the FHIR model objects, but it also provides a library for a FHIR client and the model objects. The great thing about FHIR and how it's designed is if you've got a client that understands the FHIR services and the potential profiles, you can connect up to any FHIR server, right, and understand the data. That's great. It's kind of going on the whole hypermedia paradigm there, where you could have a browser that could browse the data. Happy is actually started and is led by our friends in Canada. You can get a hold of Happy up there in that URL on GitHub, or just do Happy FHIR at GitHub. There are several U.S. healthcare and software entities software company entities contributing to HAPI, you can go be involved by going there, by going to the URL. There are others, several other FHIR implementations available as well, as I said before. I'm just making note and letting you know about the HAPI FHIR implementation. So once you have your FHIR server stood up and you're exposing, ready to expose your FHIR APIs, now you need to think of those platform capabilities. And it really is a platform, and it should be a singular platform from end to end that, you know, handles licensing, quota management, partner management, that is PCI compliant, that can do provisioning, you know, monitoring, that provides a developer portal for where you can manage your consumption, right? Manage that relationship of who's actually using those APIs, and where they can come and find, where that clinician can come and say, wow, what kind of data do I have access to? Okay, let me play around with this in the developer portal. And they can socially engage with other people. That's where the developer portal comes into play. Lifecycle management, I kind of put that in a funny spot there, because that's the main underpinnings of everything. Even how you build out, it's how you build out this with a DevOps experience, right? You know, when you decide, okay, you know what, now we're ready, besides these 16 resources, I'm ready to onboard another resource, another service. How do you manage that life cycle? How do you auto-deploy that? How do you get that out there very seamlessly in a timely fashion, and make sure everything is in compliance with the FHIR server and a specification? The gateway, again, the security is very important. You know, you need to be able to hook up into your identity management integrations. You need to do protection against, you know, denial of service. You need to be able to do quality of service, mediation. You need to be able to do some orchestration, because one of the things about the FHIR API is being able to combine multiple resources in order to create a document or a message that you send. And so you should be able to orchestrate that type of capability and build that out. And finally, analytics. You know, you should be able to support, the platform should be able to support all sorts of analytics, from just monitoring of how the platform is running, because remember, getting the data, you know, to the right place at the right time is extremely important. The system needs to be able to stand up, be very enterprise operationally ready. So you need operational monitoring of your system, of the APIs, and all the way to consumer monitoring. You know, who's consuming, you know, is the ambulatory service consuming a lot of API, you know, making a lot of requests to our API, or are the payers actually making a lot of requests to our API, and why? And so you should be able to find out that type of information. And then also take this to the next level. Take it to the level for your analytics to see what is, how can you provide the higher level service. So when you put this all in a healthcare solution platform, this is kind of the architectural view of it, where you have life cycle management that covers everything from the very initial thought of an API all the way through to the runtime management, and have that in a complete automated fashion, so that you can do that DevOps and continuous delivery that you need to, that enterprises need to work with nowadays. On the other side, we have analytics. Analytics covers the whole gamut from the design time all the way to the runtime. In the center here, we start out with, you've got your data sources, right? You might have an Elasticsearch, you might have your big data store, but you're going to have multiple data stores. How do they map into your FHIR server model objects up to your FHIR server? Your FHIR server services are exposed through your API gateway, and then finally out into that developer engagement, the developer portal. So here's where I start getting specific to Akana. Akana provides a digital healthcare business platform where we provide the security, the underlying security, the life cycle management, the API management, the cloud integration, so being able to, like I said, be able to combine those resources to provide a document, a healthcare document that you need to be able to easily orchestrate that, and then provide the analytics across the whole platform as well. The Akana platform looks like this. Down at the bottom, we have a Lifecycle Manager, which, again, manages the full life cycle, gives you that DevOps and continuous delivery ability across the whole runtime. We have the API Gateway, which provides the service and cloud integration, as well as the gateway capabilities for security, denial of service, and things of that nature. On top of that, we have the Community Manager, which provides the developer engagement, right? So being able to interact with the different players that are going to be consuming your APIs. And finally, we just announced last quarter Envision, which is our analytics platform that interacts with everything in the Akana platform, and you can also plug other systems into the Envision or plug Envision into other BI systems. So here's what the Akana healthcare solution looks like, built, based on our requirements from above, where we have the Akana Lifecycle Manager over fulfilling the lifecycle management and complete automation. On that realm, we have Envision providing the operational API and business analytics, and then we have in the center we have services. You can leverage your own FHIR server, but we also provide services for based around Happy to provide FHIR server and the FHIR model objects in order to map into your data sets, along with our API Gateway and Community Manager. We provide a set of professional services based on healthcare. So these are folks that have been working in the healthcare field and will be able to help you realize your interoperability and manage your APIs. We have a flexible deployment model. We have a cloud model, so you can have a SaaS model, so you can have it all up in the cloud. We have our solution is available completely on premise, and we also have the hybrid model, which tends to be the flavor of the month, pretty much, where you have basically you have a hybrid. Some of the things are in the cloud, and some of them are on premise, and it's really based on your business and security and all the different requirements that each individual would have. So, APIs really help you reduce the complexity of providing healthcare, right? So Akana can help you provide secure, scalable, managed, standardized API access to your electronic healthcare records, and really is going to enable you as a provider or player in the healthcare space, take it to the next level, take it to the higher value service. No matter if you're the actual healthcare provider or if you're a company providing different devices that generates data that could be valuable to someone else, or just being able to integrate that data easily back into the provider or the specialist that needs to have access to that data, we can help you do that. We have plenty of resources available. You can read about our healthcare solution on akana.com. We have the Resource Center, and you can also, I forgot to put our blog up there, but if you go to our website, we've got a blog, and I have a blog, a more detailed blog on the FHIR profiles and APIs that you can read up there. And you can also follow us on LinkedIn and Twitter and Facebook. I believe we have Facebook as well too.